Welcome back to part two of what every long-term care policy holder or beneficiary needs to understand about claiming benefits for Parkinson's disease. As I've explained, PD is a progressive disease and it can impact activities of daily living. When you're purchasing a long-term care policy, you are basically reaching an agreement with the carrier that says, look, if I can't do certain activities of daily living, a certain number of activities of daily living, I qualify for these benefits. And the assistance can be provided at your home, in a nursing home, a daycare facility. And so it's really important to understand what are those activities. It's important to understand where the facility is and any limits on those facilities. But we are first going to be addressing the diagnosis and the symptoms and functionality. And as I discussed in the first video, the carrier is going to be looking at the medical records and the plan. And they are going to try to determine what your level of functioning or the level of functioning is for a loved one in terms of the physical functioning, the cognitive functioning. And they want to ultimately understand what activities of daily living can't be performed. And again, I think it behooves you to understand that they're going to be looking at the medical records to find that correlation between the diagnosis, the symptoms, and the functionality. So just because someone has been diagnosed with Parkinson's doesn't mean that you or your loved one is entitled to the long-term care benefits. Before a claim is filed, I think it's crucial that the medical records be reviewed to confirm the physical and the cognitive impairment, and that it's adequately addressed in the context of the medical records in terms of symptoms. So the medical records talk about symptoms, then they should be talking about functionality from a physical or a cognitive standpoint. Within my view, concrete examples of problems that you or your loved one might be having. So for example, you might be having problems with changes in your speech or swallow or gait. You might be having some cognitive issues. Sometimes a mini day in the life video can document these particular problems as an adjunct to the medical records. But this all starts really with the role that your doctor is going to play. In my view, great medical records that tell a story can make all the difference. Obviously, you need the support of your physician, but this starts in the medical records that are documenting the objective basis of the diagnosis, the exam and test findings, the disabling symptoms, and explains why you or your loved one can't do or need assistance with the applicable activities of daily living as defined by the terms of your policy. Now, I have the physicians not only do a sort of a care plan, but I also have them complete a residual functional capacity form. I use this PD form in my Social Security claims, and I think that it asks the specific and right questions regarding symptoms and functionality in a PD case. I want that to be consistent with a detailed care plan that discusses the nature of the services, the frequency of the services, and how these services are required for this particularly impacted activity of daily living. Now, if your doctor refuses or is not a really good historian, doesn't support the claim, I think it's time to find a new physician, because you really can't win one of these claims without the support of a physician. Got it? Now, in my next episode, I'm going to be talking about the games that long-term health care carriers play in a Parkinson's disease claim. See you in a minute.